This is Dr. Kalyan Chakravarthy. I'm a consultant endocrinologist at Idea Clinics in KPHB, Hyderabad. Today I'm going to be talking about hyperthyroidism and why does it happen, what are the symptoms and how to treat it. Hyperthyroidism is a condition where your thyroid gland, which is a gland which sits in your neck, it produces more hormone than what is essential. There are 2 or 3 reasons why this can happen. Sometimes there might be some nodules in the thyroid which is producing more hormone. This is more commonly found in the people who are 50 and above. In younger population who have hyperthyroidism, it is generally due to a condition called Graves' disease, where the whole of the thyroid gland starts producing more hormone due to a stimulation called a thyroid antibody, which is an antibody which is targeted against our own cell. Our own immune system works against us. It produces antibodies that stimulate the thyroid gland rather than destroying it, like in hypothyroidism. It stimulates it to produce more thyroid hormone than what is necessary, causing all the symptoms of hypothyroidism. So this is Graves' disease. There are some other reasons why it happens. It's because of thyroiditis, where there is a transient attack in the thyroid because of a transient viral infection or a transient inflammation, and that can give you something called thyroiditis, where your thyroid gets inflamed. It starts giving out all the thyroid hormone out into the system, but it generally settles by itself. But this is very rare. Generally, it is either the Graves' disease or because of some nodules. So these are the causes of why this happens. What are the symptoms? How one can recognize whether they have hyperthyroidism? In stark contrast to hypothyroidism increases your basal metabolic rate. It increases the pace at which every cell in your body works. So one may experience mainly symptoms that are related to the heart, which is increased heart rate, palpitations, high blood pressure, sweating, tremors. Then patients can get confused or very agitated, mood swings, increased bowel frequency, weight loss. So exactly opposite of what you would see in hypothyroidism, because your body is working in a 5th gear constantly. You're running at a rapid pace. It's just like a body is constantly doing a marathon, and so the person will become tired also. He will not be able to have enough energy to last him through the day. So patients can actually get tired by the end of the day, and that is also one of the common symptoms of hyperthyroidism. And once you recognize any of these, please check your thyroid functions or consult an endocrinologist, who will then start treatment. What are the options available for us for hyperthyroidism? We can either start on medicines. They are designed to block the iodine treatment, iodine that is taken up by the thyroid gland. Thyroid gland's main source of fuel, your thyroid hormone, is an entity of 4 thyroid. Your T4 is an entity of 4 iodine molecules. Your T3, which is another thyroid hormone, is an entity of 3 iodine molecules. So it is just a combination of a protein called thyroglobulin and iodine molecules. That is your thyroid hormone. So what this anti-thyroid drugs do when we give it for hyperthyroidism is block the thyroid from taking up iodine from the blood circulation. And what happens consequently? We can halt the factory. We can halt the thyroid manufacturing process to the pace that we want to. If the thyroid is producing up to 300-400%, we have to slowly reduce it down to 100% of whatever the capacity that the patient is producing. So we give anti-thyroid drugs. Whether this is permanent or temporary, it depends. Some people respond very well. They don't need tablets more than 1 year. Some people have a large goiter or some eye signs, and some people require a longer course of treatment because the disease tends to be longer. Or sometimes we give something called a radioactive iodine. What is radioactive iodine? It is just a iodine. As I told you, thyroid is a very hungry hormone, hungry for iodine, especially when it is producing it at a much higher rate, just like in thyrotoxicosis. So it will take up all the iodine that is available in the blood circulation. Now, radioactive iodine is a way where we poison the iodine. We give a poisoned iodine to the thyroid, and the thyroid just takes up all the poisoned iodine and just kills itself essentially. So we are not depending on that abnormal thyroid gland to produce your thyroid hormone anymore. We stop making that thyroid from that thyroid gland. We put it aside, and then we give you thyroid hormone as a replacement orally. So that is the treatment for hyperthyroidism. Predominantly it is antithyroid drugs. Sometimes if the antithyroid drugs fail, or if the disease is going up too long, we can give radioactive iodine. Other than that, it's a safe disease. You will not have any major problems with it as long as the thyroid levels are well controlled. It's an easy disease for the endocrinologist to treat. So if you have any doubts, please write in the comments box and we'll be happy to answer. Thank you very much for listening.